Friday night. As I always say, get to the table with a glass of wine, apple juice, milk, tea, whatever your taste buds calls for, and sit back and relax. But in the meantime, call a friend, call a family member, and tell them to get to the podcast, get to the YouTube, because we have some really, really good information for you tonight. And as I always say, there's a request line to call in, and that's area code 310-910-9676, extension 1. Again, 310-910-9676, extension 1. I pray that you've all had a great week, and now it's Friday, and you're looking forward to that weekend. And as I say, enjoy family and friends, mask up, and enjoy. Now, tonight, we've had quite a few people on with different illness, and some has been amputees, some has dealt with cancer. And tonight we're going to talk about holistic medicine. And I thought it would be something that we all should kind of get an idea. We hear about it, but not really knowing all about it. And I have someone with me tonight that I'm so excited that she's here. We've been knowing each other for about 3 or 4 years now. And we met with this other particular project called Dynamic Pay, and through Dr. Marcia Glenn, which is a dermatologist. And I often think about Dr. Glenn and the friendship that we extended and how we've met, how she's allowed me to meet another young lady that I just have a lot of respect for. And tonight we're going to talk about holistic medicine. I'm going to let her talk about it, because as I was talking to her yesterday, she was saying some things that was very, very, very interesting to me that I had not known anything about, because I just heard the word, heard about it, but not really knowing about it, if you understand what I'm saying. So tonight, if you have questions, call in, and let's dive into that holistic medicine. And I just want to say hello to my friend Lynn Goodlow, MD. How are you tonight, Lynn?
I am very well. Thank you so much, Gigi, for having me on and letting me talk to people about wellness and health and prevention and taking our health back. So it's really important. So I started after medical school and doing a little general surgery. I was trained in ear, nose, and throat, head and neck surgery. And the long fancy name for that is otorhinolaryngology, but that's ear, nose, and throat.
That is a long name for it.
Ear, nose, and throat, and head and neck surgery, which I enjoyed. I did that for a good 26 years. So if somebody had a problem, if I couldn't take care of it in the office, we went to the operating room, and if it was something bad, we cut it out. So it was good. I enjoyed it, but it was hard work.
Was it?
It was long hours.
Was that the hardest? Was just the long hours, or was the particular of the surgery, or what was going on?
A combination of both, because we did do some head and neck surgery, and that's long, tedious surgery. But a lot of the cases were short and outpatient. But the repetitive surgery, you can often end up with carpal tunnel, trigger thumbs, sore necks and backs from being in that position so long operating. So what I did, I retired early, and I also had gotten introduced to integrative holistic medicine, and I liked it very much. And interestingly, when I was doing ear, nose, and throat, patients would often ask if there was something natural they could do for their problem rather than always doing medication. So I got interested in sort of the natural medicine, and I went down to Scripps in San Diego, and I trained and learned about integrative holistic medicine, and I got my boards in integrative holistic medicine.
Let me ask you this. What made you get into medicine in the very beginning?
In the very beginning, I just like helping and taking care of people. So I didn't want to go through teaching and research. I just wanted for help regular people get well and stay healthy.
Why the ears, nose, and neck and all of it?
I liked the surgical approach, and I liked that particular area. I wasn't interested in brain surgery. My ex-husband did that.
Oh, okay.
And I wasn't interested in the colon and the bowel, but ear, nose, and throat was an interesting area because you could do just ears, you could just do nose, you can do throat, you can do allergy, and it was all ages. And it was interesting, and I really did enjoy it.
Now, you were at Kaiser?
Yeah, at West LA Kaiser.
Okay.
And I was the chief of the department there for a good bit of my time there.
Wow.
And no, really, we had a good time. We helped people, and we enjoyed what we were doing, and it was good. But the long hours kind of wear you out.
Do you miss that? Being a surgeon, do you miss it?
I don't. I did it for a good 26 years, including training. It was like 30 years. And I don't have a problem with ending one project and starting another. So I consider myself into part 2 of healthcare.
It sounds like you reinvented yourself into another,
exactly.
to part 2. As matter of fact, I have a young lady that's coming on next Friday. She was a school teacher, and she just reinvented herself, and she's 80. And she just reinvented herself as an artist, as a painter, as an artist.
I love it.
So I mean, I'm enjoying this. Here you have reinvented yourself to helping people into another field, still medicine, but it's just another field.
Exactly. So I tell people I went from a chance to cut as a chance to cure. And now I'm doing make food your medicine and medicine your food. So it's a real change. So I'm into more of the prevention, lifestyle, nutritional wellness part. So actually what I'm doing now when it comes to the ear, nose, and throat part, I'd probably put myself out of business because I keep people well and healthy so they don't get so bad that they need to have surgery.
Okay.
So it's different.
So explain to me the holistic part of it, of the medicine,
Exactly.
Versus,
So before it was somewhat of ENT is partly medical practice, but primarily it's a surgical subspecialty. So integrative holistic medicine is a field where I can still do, the integrated part means I can still do conventional Western medicine, but I also do global accepted healthcares. For example, integrative holistic medicine, you can do conventional medicine, you can do homeopathy, natural, you could do acupuncture. I mean, you recognize all the different fields around the world of medicine, and you do whatever you think's appropriate for that particular patient.
Okay.
So integrative holistic medicine does include conventional medicine, but also homeopathy, acupuncture, just other specialties too.
So it sounds like to me, before going into the natural medicine, you try to heal that person or make that person, you go another direction first.
Right.
Okay.
Right. And the interesting thing is when we docs get trained as medical doctors, in medical school, when I trained, they didn't really teach you much about nutrition. Okay. So once I got into studying integrative holistic medicine and going to meetings, make food your medicine and medicine your food. So there's an expression, I forget where it comes from, but it says, if you have a poor diet, medicine is of no use. But if you have a good diet, medicine may not be of a need. So in other words, I've discovered when you eat healthy, and sometimes if you need supplements, if you do exercise, if you minimize stress, if you sleep well, if you have purpose, love, spirituality, if you have good communications and socialization, and especially if you decrease toxins in your life. So toxins in the air pollution, and cigarette smoking, toxins in liquids. You got to be careful with some of these energy drinks at the gym. And toxins in your food, you don't like the high fructose corn syrup or the antibiotics and the hormones. And then lastly, I tell my patients I want them to minimize toxic people in their life. So if
I
you
have
can
to
get,
agree with you on that one.
if you get
Yes.
that all together, you could do a lot of good prevention lifestyle that could keep you well in many circumstances that you might not.
Now,
need
was this
everything.
something, when you retired, was this something you knew you were going to go into, or what made you go into this? Were you looking at this before retirement?
I was.
Or was it because of your experience in medicine, and I'm quite sure you saw a lot of things in doing surgery, and did you feel as though this could be another way where this could, they could do something else other than going into surgery?
Yeah. I did start this before I retired. And actually, part of it is patient-driven. Actually, 1/3 of like complementary, alternative, holistic medicine is patient-driven. Patients would often ask if there was something natural they could do before taking lots of medications with side effects and all that. So patients kept asking, and then I got introduced to integrative holistic medicine at Scripps in San Diego, and I started going to their meetings and their conferences, and I loved it. I loved the prevention and the lifestyle. So I decided to do full early retirement and then change fields and do the integrative holistic medicine. So I retired in 2007, and I got my boards in integrative holistic medicine in 2008, and that's what I've been doing since then. So actually, as I was saying, it includes lots of different global practices, and it's all about healthy mind, body, and soul, optimal health and balance, and treating the root cause of a problem and not the symptoms. For an example, I tell patients, years ago I had a young guy in the office who was pretty healthy, except for he had really bad heartburn, gastroesophageal reflux disease. They call it
Acid
GERD.
reflux, yeah.
Acid reflux.
I deal with that now.
Yeah,
Acid reflux,
yeah.
as it turns into GERD.
As it turns into
Yeah.
GERD. So when patients have GERD, I do food allergy testing. Because often if you have a food allergy, it can present with GI upset and problems. So with this young man, we did food allergy testing, and he was on Nexium, the purple pill for GERD.
I've been on that one.
So when we did the food allergy testing, he came up allergic to pork, and he was allergic to chocolate. So with food allergies, you don't do the allergy shots or the immunotherapy or allergy shots. You remove the food. So he stopped eating pork, he stopped eating chocolate, cured. No more heartburn, no more Nexium. So the root cause of his GERD was the food allergy to pork and to chocolate. So everything that I see in terms of patients that come to me for integrative holistic medicine, my focus is getting to know everything about them, and then often getting really comprehensive lab work to see what's going on the inside. But I like to do allergy tests whenever their insurance would cover it for them.
Well, I'm going to see if my insurance is going to cover it, because I'm coming to you, because I'm taking... Having acid reflux is no fun.
Right.
That girl is, and I'm suffering with it right now. And
Yeah.
I had called my doctor the other day and said, look, I think you need to make an appointment so you can go down inside and see what's going on.
Yeah.
Because it's no fun.
It's no fun.
And there's this little yellow pill that I'm taking now.
There's so many different little
Yeah, I'm
pills.
taking this other little yellow pill
Yeah.
before I eat, so that
Yeah.
whatever I eat is good.
Now, the other thing is, some patients see me that have GERD, and some of them, not everybody, I can get them off their medication, say if they don't have a food allergy I recognize, by doing more natural things like aloe vera juice before you eat, and then Good Belly in the stores. It's a probiotic drink. I've had some patients do really well off the aloe vera juice and the Good Belly, so that they cut back on their meds, and some of them, when they have mild cases, don't need them anymore. So it depends. Every case is individualized and different, but there are a lot of natural supplements, Ayurveda. There's all kinds of things you can try.
I've never heard of it.
Yeah, it's an Indian form of treatment, and it's based on body type and all kinds of natural things like ashwagandha, rhodiola. I mean, they're just natural supplements and all that you can try to help all kinds of different things. I'm not saying it's good for everybody, and I'm certainly not against meds, because I do have patients on some medications, but you'd be surprised how many patients do better when they eat healthy and they have supplements and they get that whole lifestyle part together. So
Yeah, and all of it goes together.
yeah.
You can't do one without the other.
No. Like I go to lectures and the docs would say, who's lecturing, you can't exercise yourself out of a bad diet. And so it's not a either or thing. It's
Right.
it's eating healthy and having the motion and spirituality, everything. It's the whole complete lifestyle. Yeah.
So, it's sometimes, if not most of the time, it's hard for people to change their lifestyle,
True.
change the way their eating habits. It's sometimes very hard, but I think it's starting, as the Word of God says, it's by the renewing of your mind.
It
You have to
is.
renew your mind, because it's a mindset, so that you
It is.
can say, okay. And when you get enough of going through, certain situations and have problems with your health, you come to that mindset and you change.
Yeah, and I meet people where they are, and I'm not unrealistic, and I want anybody to be 100% vegan or vegetarian. But if they could just introduce more dark green leafy vegetables, they start feeling better. And that's where I get them. Because if you think about it, there's proteins, carbs, and fats, and the body likes all of them, good ones. But with some people, who are lactose intolerant, if you can get them off of milk, and I tease them and I say, I'm not surprised you're lactose intolerant because we're not baby calves. I want to be an 800-pound cow.
Right.
So,
right.
and if you think about it, we human beings, part of the animal kingdom,
Yeah.
we're the only animals that drink another animal's milk until adulthood. So it's out of sync with nature.
Right.
Yeah. And here's the other part. So, we all started drinking cow's milk. We all did. I grew up on it for the calcium, right?
Right.
And the cows get their calcium from the grass.
Okay.
So some of the poor cows now, when they're fed genetically modified corn and grain and they're not eating grass, where's the making
Yeah.
of the calcium?
Exactly.
So for us, for we people, the best source of calcium are the dark green leafy vegetables. Collard greens, broccoli, kale, spinach, full of calcium.
Well, is mustard greens full of calcium?
Yes,
'Cause see,
ma'am.
I love mustard greens.
Yes.
I'll do collards every now and then.
That's okay. But the
my-
dark green leafy vegetables are so healthy and full of calcium. And if you think about it, the fruits and the vegetables are where all the good vitamins, minerals, and immune protecting stuff is. But animal protein here in the United States, animal protein, animal fat, just gives you a lot of inflammation and cholesterol. Now, when you eat it, grass-fed and organic and all that, but a lot of the meat here in the United States, the way it comes about, it's not that healthy.
No, I don't do pork like that.
Good.
No, I don't. Except for every now and then I want some bacon.
Yes.
Every now and then.
Understood. People
But-
and their bacon.
Yeah, but just saying eating pork, I don't do pork.
Yeah.
I do more fish and chicken,
Yeah.
and
that's good.
turkey.
Yeah.
And sometimes I get so tired of eating chicken till I'm saying, oh,
I know.
it's chicken out.
Chicken.
But there's so many different ways you can prepare chicken.
Absolutely.
But that's what I eat more.
Yeah, but a while ago, the World Health Organization would organize food groups into different categories. And group 1 foods were highly carcinogenic. If you eat a lot of it, you might get cancer. And that's red meat and processed red meat, the salami, bologna, pepperoni. Say all the football fans now are hating what I'm saying, right? But and then so salami, bologna, pepperoni is not that healthy for you. You can do it every now and
Every
again.
now and then.
And the red meat, the hamburger, hot dog, steaks, every now and again. And then pork's up there too.
Tell me, what causes inflammation?
Inflammation.
And I'm asking that because, as I say, this is bring it to the table, and I have to put myself on the table.
Absolutely.
I can't have everybody else on the table and not put myself.
Mhm.
And I'm asking that question because I've been suffering with bursitis
Uh-huh.
in the hip,
Mhm.
and sometimes I could hardly walk.
Yeah. Well,
And I found out I had the MRI done,
Yeah.
and I've had the X-ray done, and
Yeah.
it comes back showing I've got a little inflammation there. Some part
Yeah.
of it is arthritis, but
Well, actually, anything that has an itis in it is inflammation. Bronchitis, gastritis, arthritis, all of them. But the basic cause of all disease is inflammation. So, when you cut yourself and you have a cut and you get the redness and then it heals over and goes away. So that's a little inflammation, but it's gone. But anything in your system causing chronic inflammation is not good. So chronic inflammation can come from eating bad food. It can, it can just come from all different causes. It causes allergy, infection, tumors, all kinds of things can cause inflammation. But the basic problem with anything, diabetes, brain problems, anything, is chronic inflammation. So if you think about eating anti-inflammatory foods, which are fruits and vegetables, and anti-inflammatory supplements in some cases, like vitamin D, which is amazing. Everybody should be on vitamin D.
I'm on vitamin D. I take vitamin D.
I mean, long before COVID or anything, the baseline, a good multivitamin, vitamin D, and then fish oil, omega-3, all those are anti-inflammatory.
Well, I need to get back. You know what? Again, everything starts with self. You know what I mean?
Right.
And I take vitamin D. I take C.
Good.
And I take fish oil. I take it and then I stop, and I have it sitting up there.
Yeah, well, if you have a good one, some people, like anything in life, you've got good ones, okay ones, and great ones. But a good fish oil should not make you belch up fishy smell, but it could have a nice lemon taste to it. So yeah, but fish oil is really good for the brain and the heart and the joints and the skin. It's anti-inflammatory.
And I take like I said, vitamin C. I do B12.
Yeah.
As well.
Yeah. Well, B12 is great. It's fine, but actually, all the B vitamins are better. So one of the multivitamins I take and we carry in the office has all the B vitamins. It has C. It has a little D, but you always need to take the D separately because there's not enough D in a multivitamin. And then, zinc and magnesium. A good multivitamin.
I take magnesium.
Yeah.
I take that, but I don't take zinc.
Now, zinc is one of the things that people really should know about. And known about it forever in terms of good immune systems. So vitamin D is like vital. It's the sunshine vitamin. You make it. But it's great. It's great for your teeth and your bones. But vitamin D actually... D3 actually acts like a hormone. There are vitamin D3 receptors across all your body and in your brain. And the higher the vitamin D, the healthier you are, the better your immune system. So vitamin D is really important. But zinc, actually when you have a high level of zinc, if there's a high level of zinc in your cell, if any kind of virus gets in there, no matter what kind it is, zinc stops viral replication.
Really?
So in terms of just staying healthy and well, the C, the zinc, a lot of the vitamins. And the best way to advise somebody exactly what supplements they need to be on is looking at the lab work. So I check people's vitamin D levels. And if you're not on D, usually you have a low vitamin D because none of us can stay out in the sun long enough to make a high vitamin D. And then if you stay out in the sun too long, you got to worry about skin cancer. So vitamin D is a vitamin you have to take as a supplement.
Right. I know when I'm still under my cancer doctor, Dr. Orr, and I love him.
I'm sure.
Yeah, I love
Good
Dr.
doc.
Orr. Yes.
Yeah.
And I go in once every 3 to 4 months, 6 months, and he checks my platelets and everything.
Good.
And when he do, sometimes he'll come back and say, "Okay, Miss G, I need to up that vitamin D."
Yeah, absolutely. Actually, the recommended dose now is 5,000 IUs a day. When I started taking it a long time ago, it was 1,000, then it was 2, but it's 5,000.
I think I'm at 5,000
Yeah,
now.
and if you take it with vitamin K, the vitamin K helps direct the D into your teeth and into your bones rather than and direct the calcium too. So you want your calcium into your teeth and your bones. You don't want the calcium going into your kidney as a stone or into your blood vessel as plaque. So vitamin D with vitamin K is the optimal thing now.
So now the vitamin D, does it carry the K, or do you get it separate?
There are supplements that come with vitamin D and vitamin K.
Okay.
Or you could take the vitamin D and you could take the vitamin K, but there are supplements that come with both of them in there. Yeah.
So taking the vitamin D3 and the K.
Mhm.
Now tell me, what about vitamin E?
Yeah, vitamin E. Actually, the multivitamin I have that I take has E. It has all the B complexes. It has a little A, a little C, and D. I take extra C and D. But yeah, it has vitamin E in there too, which is another good antioxidant. So taking a good multivitamin that covers a lot is healthy for you.
So along with that, and so this is how you work with your patients, is doing the multivitamins and trying to heal them outside of taking any other medication.
Well, no, it depends upon where they are. I meet them where they are. Some are coming just to be healthy. Some are having issues they haven't resolved. So, but a good baseline for a lot of people with the standard American diet, which is abbreviated SAD, which I feel is SAD, because you really need more fruits and vegetables.
Okay.
Listen, so it depends. It depends upon their symptoms, what they're on. Because I'm usually not their primary care doctor. They usually have a regular medical doc, and I tell them I'm their prevention, lifestyle, nutritional part of their health care.
Okay.
So if they're coming and they're on meds, but they have a terrible diet, they're not exercising, they're stressed out, they're not sleeping right, if their hormones are off, their labs are off, I want to get them balanced.
Okay.
And then, we can work together. I'm part of the health team, but you'd be surprised how many people, once they get their D up, and if they need a multiple vitamin, because they come for all kind of reasons, but fatigue, more energy, weight loss, there's a lot of balancing. People don't get with their regular doc, and they don't have time, So that's why it's good. I can do the prevention, the lifestyle, and the nutritional part, along with maybe their other docs, and then all together we can get them at a healthier state.
It sounds like to me that this is what everyone needs this part in their life.
They do. They do.
And you correct me if I'm wrong, and especially when you reach a certain age.
Right.
I would say maybe when you start hitting that 40 mark, going up, you need that.
Actually, it would be great if even kids started doing things early, because unfortunately we have such a terrible case with obesity in children now. I mean, obesity everywhere in the United States, but too many kids are obese and getting early diabetes and getting stents put in because their blood vessels are clogged up. That so much of that is preventable if you can get them eating right, exercising, all that early on.
And you know what? And I think that starts from the baby, when the baby first get here.
Oh yeah.
When the baby is first born.
Yeah.
And after it comes off of that formula, I think they need to start teaching them how to eat right. As the parents, we need to give them the right foods, right supplements.
Yeah.
Because they get so accustomed to the sugar with the candy till it's, and the soft drinks and things like that. My son, he didn't like sweets when he was a kid. Good. Have his little birthday parties. Everybody else eat the cake but him. But now, he has certain sweets that he eats.
Yeah.
But he also wouldn't eat. You can sit down and prepare dinner. Now, he may want meat and no vegetables. The next time he may want vegetables and no meat. You know what I'm saying?
Yeah.
So, but even now, he still, watches pretty much kind of what he eats.
But, and you're right. The earlier you can get babies doing things healthy, the better. And a lot of parents are just smart, and they look at it by themselves. They investigate it. And there's some pediatricians get in it too. But remember, As I said, most MDs are not taught a lot of nutrition in medical school. So I think
Why is
it's getting
that?
better.
What's that?
Because you know what? I don't think it's thought of as being important. They want you to learn disease and drugs to treat disease. See, the difference between integrative holistic medicine and conventional medicine, all kinds of things. As I said, you know, the whole lifestyle part is
Seemed like
traditionally the PAT has not been part of it. But the other thing with integrative holistic medicine, you and the patient are partners. It's not like just do this, do that. You need that feedback.
Right.
And, you know, pain is a lesson to learn from. We got to find the root cause of it. And, you know, the way you look at health, integrative holistic wise, it's not disease based, it's wellness prevention based. And it's all about learning and leading by example and understanding about love and spirituality. There's way more to healing than just medicines.
It seemed like
And again, I'm not knocking medicines,
No,
but
you
but
know, I
just starting
understand.
other lifestyle is important too.
And lifestyle has always been important, I thought. You know, but it seemed like they would have wanted to put them hand in hand, you know, together.
Yeah.
Maybe not completely, but add some of that into that as they're
exactly.
teaching, as you're going through the school,
And
medical school.
also, longevity is 30% of your genes, 70% of your lifestyle. Because the food you eat can change genes. Even the you heard of the microbiome and the good bacteria in the gut.
Right.
The bacteria have an effect on the genes. Your environment has an effect on the genes, and your food has an effect on the genes. So, when I was in medical school, they pretty much taught us if you had bad genes, hang it up. That's not true at all. Your lifestyle can trigger good genes or bad genes. So if you come from a family with cancer or diabetes, you do not have to go down that same path. If
No,
you
you
can
don't.
change your lifestyle and your food, and you just don't have to do it.
Yeah, I believe that.
Yeah, so it's really important to eat right, exercise, stress, sleep, the whole shebang again.
Stress is one of the biggest things that I think
You're right.
we have to work on.
We do, especially in this last year or so, right?
I try not to be stressed, you know. I really do. And I try not to be stressed because, first of all, I don't like drama.
I'm with you.
I can't do it. And I don't want it in my life. I just can't do it at all. And so I try to stay away from that. And I know that's the reason why I don't have a lot of people running in and out of my house, and I don't run in and out a lot of people's houses because
Gotcha.
I just don't want that vibe or the stress to come upon me.
I don't blame you.
I don't. And I'm comfortable at home. I'm comfortable
Good.
in my own space.
Good.
You know. And then I'm so busy too. I don't have time to have a bunch of people running in and out. So
Understood.
but
you know,
the stress.
75 to almost 90% of the reasons why people go to make an appointment for their primary care doctor is based on stress. That's how bad it is. And there are a lot of good natural ways to decrease stress. You know, the deep breathing, the walking exercise, prayer, meditation. You know, there's just ways to deal with it.
Right.
And it should be discussed. It shouldn't just be, you know,
Right.
go
Exactly.
home and whatever.
Yeah.
You need to really address it.
Yeah, you know, it's you know, I worry about some things, and because that's just natural.
It's natural.
It's natural to have some kind of stress at one time or another. And this last year, and a half, 2 years, you couldn't help but stress.
Oh, true.
In certain areas,
True.
you know. So I do have some.
Yeah.
But to say
A little bit is kind of gets you motivated, but not a lot.
Not a lot. I just can't deal with
Yeah.
a lot at all.
Yeah.
So, like I said, this last year has been, and it's still a lot of stress.
There
It's
is.
still a
It
lot
is.
of stress in it.
But I go to a great church with a great pastor, and she teaches us, you know, not to worry about anything, but to pray over everything. So that's what I try really hard to do.
You know, I've heard Pastor Austin F. Williams of True Vine Baptist Church said, if you're going to pray, why worry? If you're going to worry, why pray?
And worry is not in the Bible,
And
is
it's
it?
not. So,
No.
so
But
you can't
pray.
worry. Just
That's
pray.
right.
You know, just
Mhm.
pray.
Absolutely.
But that stress is one of the biggest, I think, in one's life.
It
the
is
stress.
the stress, and then the mental illness. You know, but that, you need that healthy balance, mind, body, and soul. You need the whole part to that. So yeah.
Now, coming to you, they get all of that. Is it just you, or do you work in one aspect of it and you have your colleagues work in another
Well,
aspect? So how does that
my
work?
practice is a multi-specialty practice.
Okay.
So I do the integrative holistic medicine, but we have nutritionists, we have a chiropractor, we have esthetician. I get the whole general picture, and I get the lab work, and then based on what I get, they may see the chiropractor, they may see the nutritionist, they may see the esthetician, or if I think they need to see another specialist, we'll do that too. But addressing the whole lifestyle, you get a picture of what's going on with them, where they are, what they need to improve, what they need to decrease the stress. They need to sleep better. Sleep's a big one too. A lot of people are not good sleepers, and
What would you say is a good sleep? Does it depend on the individual? Is 8 hours less than 8 hours?
Yeah,
or
no,
what?
7 to 8 hours of sleep. And a lot of people have a hard time going to sleep. A lot of people have a hard time staying asleep. A lot of people need to be evaluated, have their sleep evaluated, because they might have sleep apnea and they'd be holding their breath or snoring. So,
Yeah. Well, I do have sleep apnea.
oh, you do?
And I do have a machine.
A CPAP?
I have a CPAP.
Yeah.
And I pay attention. I try to pay attention to my body.
Absolutely. I try to teach patients to do that too, and a lot of them do that too.
Yeah.
So it's good.
And I know when I've gained a little bit more,
Yeah.
because
It gets worse.
It gets worse,
Yeah.
and then I can hear myself snore.
Oh yeah, yeah.
I can lay down and I hear myself snore. I say,
Yeah.
"Oh, girl, you done gained a little bit," but being on the machine, and I get up in the mornings, I'm refreshed. I feel
Better.
I feel better.
Yeah, when you
It's
have a good
really good.
machine, a good fit, and a good setting, it definitely helps
And the
you.
machine I have, it monitors
Monitors
my
yeah.
my sleeping.
Good.
And it knows what I need.
Yeah, I mean,
So-
some of these technological things, these Apple Watches and stuff,
Yeah,
do that
yeah,
too.
yeah.
It's amazing.
So I do have sleep apnea.
Yeah.
And I do know it's important. My weight is very important.
Yeah,
So,
Yeah.
and a lot of people don't realize they have sleep apnea.
right.
And
If-
I didn't know I had it until someone said to me, "You stop breathing in your sleep." I said,
Yeah.
"I stopped breathing in my sleep."
Yeah, you need
They
somebody
said,
there
yes. And that's what made me go to
Good.
see about it.
and get it worked up.
Yeah.
Because if you don't sleep well, because your brain's active all the time, but it does need your sleeping down time too. And there have been studies, especially in the military, where soldiers go for days and days without sleep, and they think they're just fine. And if you test certain tests of alertness and all, they are not fine. It is not good not to have good sleep. It can be dangerous if you have a very detailed, specific job or people's lives in your hands. So a lot of people can't lose weight until they get their sleep under control. So sleep is very important.
And and I'm just going to say this, don't be embarrassed if you have sleep apnea.
No,
Don't be embarrassed if you have to sleep with a machine, because I'm telling you what, it's saving your life.
it is.
So don't be embarrassed. Get that machine.
Right.
I've heard some people say, "Well, I can't have that over my nose. I can't." There's different machines, and there's different little equipment for you. So
And it takes time to get used to it.
Yes, it does. And
Yeah.
now sometimes I say, "Oh, I'm not going to put it on tonight," but you know what? Before it's over, I'm reaching for it. I said, "Let me put it on."
Because you get better quality sleep.
I do, and
Yeah.
I feel a lot better. So
It's important.
it is. So I tell everybody, just if you have it, if you're snoring a whole lot,
Absolutely.
and then you have to watch your what they call your adenoids. Is that?
Oh, tonsils and adenoids?
Uh-huh.
Yeah. When I did ENT, I took out a lot of tonsils and adenoids because they were just too large and obstructing. And these poor little kids were trying, it's like breathing with two golf balls in the back of your throat for the tonsils and the adenoids. And many a young kid would come in, mouth breathing because they couldn't breathe out their nose because their adenoids were blocking it and they could barely breathe out their mouth. And after the surgery, they were so quiet, then the parents would check on them to see if they're still breathing, but they were finally getting restful breathing. So that's the whole point of evaluating and getting worked up for sleep, to see if there's a pathologic cause, or you can do sleep studies. So it's important. The whole point is all aspects of a lifestyle, you try to get them as normal as possible. And I'm not a food Nazi. I'm not trying to turn everybody into a complete vegan or vegetarian, but just add more healthy food in there. Like 80% of the time you try to eat healthy, 20% you can cheat a little bit. So
right.
Because I don't expect perfection, but I do expect improvement that'll help you be healthier. So.
Right. I have to get, and they say broccoli is one of the best things.
It is.
You know what? Now, don't laugh. I'm not a broccoli eater.
Okay.
But now, you know how when you go to parties and they have the relish tray?
Yeah.
I'll take the broccoli and dip it with, and use the dip. I love it that way.
That's fine.
But then cooked broccoli.
You don't have to do cooked broccoli.
I'm not so.
I like mine more raw. But again, any of the dark green leafies, and cooked or not, the arugula, the Swiss chard, broccoli, spinach, kale, Brussels sprouts, asparagus, all the dark greens are amazing. When you're eating them, they're healthy for you. You're not gaining weight because they don't have carbs and fat. And actually, the dark green leafy vegetables, when you eat a lot of them, will clean plaque out of your blood vessels. There's not a medication that I know of that'll do that, but the dark green leafies will do it.
Now, I like salads. I'll do a lot of salads.
That's okay.
I like salads.
Or you can do the frozen organic greens in a smoothie. The greens and a protein powder, some organic fruit, almond milk, something, and that's good.
Now I do almond milk.
I'm just not big on cow's milk because we're not baby calves. I want to be 800 pound cows. So the almond, the oat, the rice, the coconut, hemp, cashew, all the nut milks. I like those. Yeah. And people say, but I'm on organic milk. I said, it's still organic cow's milk, and the cow may not have been eating grass, so I don't know where the calcium is. So the dark green leafy vegetables, your best source of calcium.
You can't go wrong with that.
No, you can't.
I just love all this information, but I'm going to take a moment and give a shout out to a couple of people that I want to say hey to Lehman Scott. The intro that you hear before I come on to speak is called Her Mystical Journey. And Lehman is just he's awesome in his music and how he produces and writes. So I just want to say hello to Lehman. I just want to thank you again for Her Mystical Journey. And if you want to learn more about him, about Lehman Scott, and you want to look and get some music of his, go to his website. It's Less Word Music, and I'm going to spell it because it's spelled a little bit different. It's LESWORDMUSIK, Less Word Music. Again, that's LESWORDMUSIK Productions.com. Check him out and see what he has to offer, and I'm quite sure you'll find something there that you might want to purchase yourself, and he'll be right there for you. Also, I just want to send a shout out to a young lady that I mentioned her last week, but I need to mention her once again because I appreciate her so much. She's the one that did my website, and she's awesome in building website. I was having some problems with my old website. I couldn't get it redone because nobody knew what to do, and I was introduced to Cheryl Austin Cheney, and she's just awesome in doing websites. So if you're looking to have a website built, I would recommend you check out Cheryl Austin Cheney, and you can go to her website, which is www. And I'm going to spell it because it's a little bit different. CGAWEBCONEPTS.com. Check her out. Again, that's www.cgawebes. I'm sorry, cgawebesconepts.com. Check her out. And if you want a website, you can't go wrong. And also, for you all that likes to have your detailing needs for your cars to be looking good and shiny, I want to send a shout out to Mr. Gamble, Mr. Glenn Gamble, the owner of Exclusive Auto Touch Detailing. Check him out. Go to his website. It's also eatdetailing.com, and that's eatdetailing.com. Check him out, or either you can call 626-328-0435. Go and let him come in and spruce up that car. And I just have to throw this out to you. He's certified and licensed in doing this. He's not just somebody that picked up a bucket and some water to throw on your car. He is totally certified, and I had no idea that you can be certified in detailing cars.
I didn't either.
But he is totally certified in doing this. So check him out. And also, there's a what they call ceramic coating that they're putting on cars. Go and have him put that ceramic coating on, and if so, tell him you heard it on Bring It to the Table, and you'll have $150 off on it. So check it out.
Ooh,
okay, yeah,
that's good.
That's good, isn't it?
Mm-hmm.
You got to take care of your car.
I have to get that information.
yes. And I want to mention something that's dear to my heart, because I am an amputee, so I have compassion for those that have lost a limb, whether it's a breast, finger, toe, whatever. I have compassion for those. J. Lynn All-American Amputee Foundation. I try to do is help those that are dealing with losing a limb. And it's not easy, and it's a mental as well as a physical. But it's a lot more mental because you've had all your limbs and now you're missing one or two. And so my foundation try to help those go through the channels of getting acclimated back into a lifestyle that's comfortable for them as being an amputee. And I can't do it by myself. I need your help. So I'm asking you to go to JLYNAAFoundation.org and hit that donation button, because I need you to help me help those out there. I can't do it all by myself. I've been trying, and I can only help when there's something there in the pot. It's not for me. It's for those peoples out there that you see that's in a wheelchair, that has no legs, but they can't get their prosthetic. Insurance don't pay at all. And the little bit that they do pay, the rest of it they feel is cosmetic surgery. So, and I mean, like I said, and this is not just for adults, but this is children as well. So go to my website, and you can see everything that J-Lynn has to offer. I'm just asking for you to have that compassion and say, you know what? Yes, I want somebody else to be able to run and jump like I can. Okay, so we're going to get right back. Thank you so much. But we're going to get right back to Lynn and to hear more about this here, holistic medicine.
Yeah, but congratulations on the work you do. That's so important.
Thank you. Yeah, thank you. Yeah.
The one thing I want to...
Is that a call? Okay.
Just before they say that, I just want to make sure everybody's good water drinkers. A lot of people don't drink enough water.
Who's on the line? Hello?
Good evening. How are you?
I'm fine. How are you? Who am I speaking with?
This is Mr. Gamble calling in.
Hi, Mr. Gamble. How are you?
I'm doing well. I came in late, but I've enjoyed what I've been listening to so far. And a quick question. How do you deal with diabetes from the standpoint of a holistic point of view?
Yeah, that's a very good question. Now, type 2 diabetes, which is what most people have, again, type 2 diabetics respond very well to a whole food, plant-based diet. again, you don't have to be completely vegan or vegetarian, but the American Diabetes Association, maybe about 3 years ago, sent out an email saying that you can reverse pre-diabetes and type 2 diabetes with a whole food, plant-based diet. And that can be strict for some people, but I have seen it. And some people that don't have a bad case of it, you can see their glucose come down, their hemoglobin A1C levels come down, their insulin stabilize. So it won't hurt you, and it could very well help a lot. The things you don't want to do, diabetics know, the fatty food, the sugar, the candy, the stuff, because you don't want to end up with the eye complications and the renal kidney problems and losing limbs and just getting worse. But you can sometimes stabilize and sometimes reverse prediabetes and type 2 diabetes with a whole food, plant-based diet.
I understand. Thank you. And my next question is now, are you taking new patients? And if so, what are the procedures to see you? And do you have to have, are you accepting those with insurance, or is it a cash
It's
basis?
All the above. Yeah,
Okay,
I have
great.
two offices, one in West Hills, California, and one in Wilmington, California. And yeah, we accept new patients, and we can usually do more with patients who have like a PPO insurance, but all patients, cash, you name it, we'll try to work with you because, you know, our heart is to make you healthier and make you better. So,
Give them information.
Yeah.
Yes,
So
go ahead.
the main office number is 818-518-5980. So 818-518-5980, and that's to Pacific Rejuvenation Medical. And then that's the West Hills office, but through that office you can reach the Wilmington office, Wilmington near Long Beach.
Where can he reach you? Where can he
Yeah,
come to you?
that number, that
Okay.
818, that's the best number for me.
Okay.
Yeah. So I do work part-time, but when I'm there, I'm engaged helping people reverse their chronic disease and get healthier.
Amen. And I assume for those who have chronic sinus issues, I was listening earlier, they need to stay away from that cow milk.
The cow milk really is not helping. So with some people is that, but the sinuses can come. The sinus problems often come from allergies, and the allergies can be food inside the house, environmental, trees, grasses. So that's why people that have sinus and allergy problems, if their insurance will cover it, we do allergy testing, and that's for inside, outside food, the whole bit. And often when you find out what you're allergic to, and you either take the shots to reduce it or remove the food that's causing it, you're better.
Amen.
Yep.
Well, I appreciate both of you. I appreciate you being on the show and having an opportunity to call in to speak with you. And I appreciate what Miss Gigi is doing with Bring It to the Table. Very inspirational as well as informational podcast. So commend both of you. And I look forward to hearing more from you. And I do have the number, so I will reach out. Thank you for taking my call, and
Sure.
you both have a blessed evening.
Thank you.
You too. Thank you for
you.
calling in. Mention that again. Give them some more information again.
Okay.
Mention it again about where you can be reached, because someone else out there might.
Sure. So again, the practice is Pacific Rejuvenation Medical, and the main office is in West Hills, California, and it's by West Hills Medical Center. It's out there. But the phone number again is 818-518-5980. And we're big on helping people's immune system, and we do vitamin injections, antioxidants, this wellness and prevention.
Okay. Well, I know I'm going to be coming to you.
Sure.
I am. I'm going to be coming to you. And I should have been there way before now, because I know that this is what you were doing, but I never understood it.
Yeah.
You know, I didn't really know all about it
Yeah.
like now, because I would love to if what type of foods I'm allergic to, and what causes the inflammation when I get it.
Yeah.
But I also want to just thank you so much tonight, Lynn, for coming in
Oh, my pleasure.
and explaining to the listeners and to people what it's all about. You know, and that
My
there are certain things
pleasure.
they don't, not to say that you're knocking your regular doctor or your physician. It's just something to add to what you're doing.
Right.
And to have a better lifestyle. It's,
Yep.
it's just another lifestyle, another way of living.
It is,
You
because
know.
actually, truth be told, your zip code is more important than your DNA code. Because if you're healthy and you're living upon a bunch of toxins, you're not going to be healthy long.
That's right. That's right. Well, I thank you so much for listening tonight. And as I say always, on a Friday night at this time, peace, one love, until we meet again. God bless.